Hello, everyone, and welcome to MBA and Chill. This is the podcast where we break down business principles through the lens of our favorite TV shows and movies. I'm your host, Claire Spahr, and today we have a very special guest. He's an iMBA alum, a man of diverse experiences and talents, Kaz Rafia. Kaz's story is nothing short of fascinating, from being a refugee raised in Youngstown, Ohio, to becoming a key player in the health equity sector as the Chief Health Equity Officer at the largest oral health think tank in the U.S. Kaz's journey is a testament to resilience and determination. Today, we'll explore how his MBA from the University of Illinois at Urbana-Champaign was a pivotal stepping stone in his career shift from clinical practice to state government and ultimately to his C-suite role. And as an interesting twist, we'll delve into his favorite TV show, Law & Order, and the world of ESPN sports to look at business concepts and the intriguing world of health equity. And later, we're going to put Kaz in the hot seat with a fun game called Policy Pitch.
Love it.
So here we go. Thank you for sitting through my long introduction.
Love it. Absolutely.
So Kaz, tell us more about your journey from early life as a refugee and where you are now, and I would love to hear about how your MBA plays into this journey as well.
Yeah, thank you so much. What a great introduction. So fun. Well, my name is Kaz Rafia. I'm the Chief Health Equity Officer for CareQuest Institute for Oral Health. My journey, as you mentioned, began back in 1986 when we came to the U.S. as immigrant refugees during the war, Iran-Iraq war in Iran. I moved from Iran here during the war after our house was bombarded. And we stayed with our aunt and uncle in Youngstown for a bit. And it was Super Bowl Sunday when we moved out of our my aunt's house to our essentially effectively like a double wide. And I got a job at McDonald's and I had a job at Jewish Community Center, and it was amazing. Listen, here's the thing, what we used to joke about on our toughest days with my brother and my tiny little sister, who was like only 2 at the time, and my single mom who raised us, was, listen, at least you don't have bombs, flying over your head in the sky. So and then from there, I went to Ohio State for dental school. I moved out west to Oregon to do my residency, worked there for many, many years as a clinical dentist with Kaiser Permanente and private practice. And then just in the past few years, I started really envisioning what a pivot from a clinical career would look like, only because I was already involved in nonprofit practice and running a business. Had given me sort of the empirical knowledge on the business side, and I figured why not formalize it, and iMBA came around.
Wow. How did you choose this program? I'm going off script.
No, yeah, this is I love off scripts. That's the story of my life, as you can tell. So I think it was a having gone to Ohio State, I hold Big Ten in a special place in my heart. Firstly, secondly, I think one of the points that iMBA likes to always make, and it's an accurate one, and so that the return on investment, the value that you're getting for what you are learning it's incredible. I would put it at 100x factor. So it was a very smart investment. On top of the fact that they have a flexible schedule, so there's reputation, flexibility, and really the return on investment for what you're paying for the education that you're getting.
Yeah, I love it. Well, I'm excited. I haven't started yet. I started this podcast as a way to connect with people because everybody says one of the biggest things you get out of an MBA is the relationships. And I'm like, well, we're online. I'm going to have to get creative. So
Absolutely. What a brilliant way to get your feet in the door. That's wonderful.
Well, thank you. So I would love to know a little bit about how your background as a refugee has influenced your current role in health equity.
Yeah, I think how I ended up in my path and a journey that we just talked about, and from my getting here, has really left an indelible mark, and it's been sort of a constant lens through which I see my world. When I was in private practice, I carved out time to make sure led teams on international trips to Nepal, to Guatemala, to Honduras, so we can
Wow.
actually provide dental care. When I joined the Oregon Health Authority as the state dental director, one of my primary focuses was to set a health equity focused strategic plan, wherein we focused oral health education in schools, telehealth, culturally responsive workforce. And so really, as you sort of glance over at the continuum of my career, my early life experience has been really foundational to my professional journey.
I'm curious because I work in cybersecurity and real estate, so I don't know all the lingo in your field. I would love to learn a little bit more about I think you said culturally responsive workforce.
Yeah. So there's there is culturally representative, there's culturally competent, there's also culturally responsive, and some of the parlance is moving towards culturally humble. And I think it's a critical piece in delivery of healthcare, wherein we are cognizant and aware of different cultural norms that play into not just being able to receive the healthcare advice that's given, but also modulating that based on the understanding of the patient, and making sure that if we're going to deliver patient-centered care, we adjust those expectations based on the person's culture.
I love that. I love that. So you, in your little questionnaire that you filled out, thank you for doing that. You mentioned that forming relationships and group development were key aspects to your MBA experience, and I would just love to hear more about that.
Yeah, so for some of us who've had this relentless pursuit of going that extra step, that drive to improve and do better, and the calling doesn't end as we get older. And I say this older affectionately. But for others, it might be one of those later in life opportunities. And some folks just train their education one after another and they get it done and over with. But for some of us, there's this realization later in life that we need to recast ourselves, recreate ourselves, perhaps improve ourselves in a different way. And when we decide to pursue adult learning that's demanding, it can really at times feel isolating, especially when you have a life and family and work and doing all this remotely. Really, for me, relationships and friendships that I've formed as part of my MBA experience weren't just an accessory to the process. They weren't just a additional thing on the side, if you will, but they were a core part of it. And frankly, there were days that there were the relationships that carried me past the finish line. So they were really critical.
Yeah. And for our listeners, Tim Graham, our first interview subject, is who introduced Kaz and I. So Kaz and me, yes.
Yeah,
I get those confused.
Tim has been an absolute stellar individual in my life in many, many ways since the iMBA program, and he's just a gem of a human being.
Yeah.
So
he's very generous and really takes the time to listen. So that's really special and hard to find.
Well put.
So you've achieved so much already. And is there anything that you're currently working on that you're excited to share with our audience?
Yeah, thank you. In my particular role, it's genuinely a privilege to have oversight of the largest oral health grant making institution in the United States. Our budget is $14 million that we give annually in form of grants to program partners who really elevate voices of community. They advocate, they work towards evening the balance, if you will, and sort of battling some of the structural obstacles that exist for communities receiving proper access and integrated and equitable care when it comes to their oral health. And that's been an absolute privilege to be part of that work. But additionally, this year we brought back our grant making RFPs, requests for proposals. And I led the effort to carve out $1.25 million, which is a large sum, dedicated solely in this particular round of RFPs that we're running, and we just launched it to individuals with developmental disabilities. And
that's
that's
wonderful.
just incredibly exciting stuff.
Yeah. Do you have any tips for people who are trying to who are responding to your RFP?
Oh, super exciting stuff. I love the plug. This is so amazing. Thank you for that. I would encourage everyone to visit carequest.org, our grant making philanthropy page. And there's information around about that grant. If this is not necessarily something that works with your organization currently, please do leave contact information for us so we can keep you updated as we have other iterations of these RFPs that we release every year. We're going to fold it into our regular portfolio of work moving forward.
That's wonderful. For our listeners, there will be links in the show notes where you can find Kaz's LinkedIn profile as well as carequest.org. So it is now time to talk about the fun stuff. Are you ready?
Let's do this. I love it.
Okay, so you mentioned that you're a fan of Law and Order. Dun dun. And you
got it down.
And you also love ESPN. And so before we get into our game, I would love to hear a little bit about what you love about these, what you love about Law and Order specifically.
Yeah, so I'll be honest with you, combining them both together, it's so silly. I think it's at the end of the day's work, it's about as easy and mindless as it gets for me. I love how people are like, oh, are you watching this and that show on HBO or Paramount Plus or this and that show? You really got to watch it. I'm like, listen, I have the attention span of a gnat at the end of the day. I'm good for about half an hour. 1, 2, I'm just glad I didn't put House Hunters as in my questionnaire, because I would have even gotten sillier. So
that's amazing. Okay, so all right, so here we go.
Yeah.
Came up with a little game called Policy Pitch. And here's how it works.
Okay.
I'll give you a scenario inspired by Law and Order episodes as well as ESPN scenarios.
Okay.
And in each one, there's a health equity issue at its core.
Ooh.
Ask.
Love it.
Your mission, should you choose to accept it, is to come up with a policy change that could address the issue in that scenario.
Okay, I love this already. This is
ready?
Awesome. Yep,
okay.
Let's do it.
Awesome. Okay, so first scenario, the star athlete and mental health.
Okay.
A top-ranking football player has been suffering from undisclosed mental health issues. He's afraid to reveal his struggle due to fear of losing and being stigmatized in the sports community. In this situation, what could be a policy intervention to address this health equity issue?
This is awesome. You should write scripts for Law and Order. This is amazing. I love the blend of both Law and Order and ESPN in this. I think at its core, and I know we're speaking and talking about hypothetical issues and scenarios, but mental health is so important to me on a personal level, and there's such a need in this space that really this, I feel like this could be and probably is an actual thing. The scenario that you just laid out. I think. What's up?
I think I lost you there for a second.
Oh,
there you are.
Fortunately, I didn't say anything that was earth shattering. But I'll just say that I think stigma around behavioral health and how we connect that implicitly or explicitly to weakness or inability to perform, they're an added cultural burden that we place on folks who are dealing with behavioral and mental health issues. And I would say that a policy remedy perhaps could be at what we refer to as micro level, really low level, and that perhaps at bargaining table, the athletes can have advocates or be able to bring these issues up without judgment or negative backlash, perhaps a negotiated policy, if you will, through the union bargaining. But this is an amazing setup.
Yeah. I love that. I love that response. I wouldn't have come up with that myself. So
thank you.
All right, here's our next one.
Okay.
Okay. The Law and Order drug episode.
Okay.
In a gritty neighborhood, portrayed in a Law and Order episode, drug addiction is rampant. Limited resources and stigmatization hinder individuals from seeking help. How can we address this issue through a policy change?
Let's see. Law and Order drug episode really could be any of the last few seasons that they had. I love that
It doesn't
setup.
narrow it down.
No, it could be any of them, unfortunately. So I love that setup. So I'll just share something with you, and I'm hoping I still have my numbers right, and anyone can fact check me on this one. But from what I recall, the substance use disorder impacts about 40% of adults, and only 10% receive care. So it's 40-10, if I memorize it correctly. We know that, like, I think what impacts it, what contributes to these numbers is that you have lack of availability of coverage, meaning insurance. You have lack of what we just talked about earlier, is that culturally responsive providers, folks who don't know the language with which you're speaking, and they can't reach you with capital R.
Yeah.
And care centers, there's not enough behavioral health care centers. And really, and even you can drill it all the way down to reimbursement structure when it comes to this. They all play a part. Now, if if you're asking me if I had what we used to call back at Oregon Health Authority, the magic wand, like aspirationally, whatever you can have to solve this issue, I'm going to just come right out and say it. I would say universal health care.
Okay, fair enough. Thank you. I want to, so we have one more setup.
Yep.
And then I want to hear more about culturally humble care.
Okay.
Because that really captured my imagination.
Okay.
So here it is. The city's lead crisis. A city is facing a serious lead contamination crisis, disproportionately affecting low-income communities. What policy change would you suggest to tackle this public health issue?
Oh, that sounds like Flint, Michigan to me.
Yeah.
So I'll give you another statistic, and this is a conversation that I just had at Harvard Medical School. I just had a presentation, and we talked about how what folks refer to as social determinants, I prefer social drivers of health, account for 80% of healthcare disparities that we see, and only 20% are in fact medically related. So 80% of everything we're dealing with have to do with all factors outside of your actual health. One of them are this environmental contaminants that you just referred to in this particular hypothetical and not so hypothetical scenario. They have a heavier toll on socioeconomically marginalized populations. We can sit around and talk about redlining and how the highways were planned in the US and what neighborhoods we displaced and all those other issues. What we do know is that they impact socioeconomically marginalized population more. And while this example sounds like Flint, Michigan, like I said, I think what would help alleviate or address some of this would be, one, upholding and not defanging environmental laws, holding companies that pollute accountable, resourcing the cities with tools and people to enforce anti-pollution laws. But also, and here's a critical piece, and I can say this comfortably, holding public health officials accountable for the safety of the very people they're charged with protecting. And that's a good place to start. Yeah,
that's good. I love that. Okay, thank you for indulging me in my little game.
Fun. Love this.
I would love in a future episode to get like a few people, and we could do a little panel discussion,
Love it.
So I want to hear more about culturally humble workforce culture.
Culturally responsive. Yep.
Yes. So culturally responsive is one thing, but then culturally humble is kind of where you think it's moving in the direction. Is that what you were saying?
Yeah. So culturally responsive, like I said earlier, really refers to those cultural nuances, be it language, be it background and ancestry, be it religion for a lot of folks, be it all those other factors that allow us to connect to someone else
Yeah.
in a truly authentic manner. One, two, being able to communicate with them and push and pull on the levers to instill a behavior change or a behavior modification, be it through diet or smoking or whatever else they might
Mm-hmm.
be engaged in.
Mm-hmm.
Diet, if you will,
Mm-hmm.
and also perhaps taking the medication they're supposed to take, but also recognizing that we may not necessarily have all of our answers that are going to apply to everyone with the same in the same tone. So
Right.
it effectively goes back to using the same brush to paint everything and everywhere. So
Yeah.
that customized, patient-centered, holistic care requires and demands that culturally responsive care. And one of
Mm-hmm.
the things that we also know that the culturally responsive care is best delivered by a healthcare workforce that originates and roots back to the community, if you will, that the workforce and the healthcare provider came from. One of the things
Mm-hmm.
that we do know is that individual providers, individual healthcare providers, oral health, physical health, or mental health, that come back from a community that come from a community of socioeconomic disadvantage and go back to their communities, they have higher rates of compliance when it comes to
Mm-hmm.
medical, dental, or behavioral health advice. And they
Mm-hmm.
have better patient affinity, if you will. And by
Mm-hmm.
that, I mean
Yeah.
patients who are closer to their providers. Now,
Sure.
taking that to another degree, if you will, is just this concept of cultural humility. And so that when you do show up in a space where you're providing care, you don't have this assumption of superiority. Now, you might have the medical knowledge necessary to address the pain and the suffering of that particular individual, or just be there
Mm-hmm.
to just literally listen to them. But I think
Mm-hmm.
that sort of power balance is really critical to having that authentic communication that's needed to really reach, as I said
Yeah.
earlier, with a capital R, the patients.
Yeah. It sounds like kind of taking the colonial mindset out of healthcare.
You're using some advanced lingo, and I'm here to love it and clap. Just that's beautifully put, because that's really what it comes down to. Because that's
Yeah.
a lot of times it's been out the way we've been trained, the way we show
Mm-hmm.
up in this space. And it really, what it does is that sort of, it's a feedback loop for many providers, wherein they show up in a space where they can't connect and communicate. So there is this
Mm-hmm.
unnecessary friction, which can
Mm-hmm.
lead to provider burnout as well. So it's not a zero-sum game. It's a
Right.
win-win for both sides.
Yeah. Yeah. That's really interesting. My son is dyslexic, and we've gone through a whole bunch of ups and downs through that process, figuring it out and figuring out what works for him, what doesn't work for him. And he's like a proudly dyslexic. So I
Love
have
it.
his permission to talk about it publicly.
Love it.
And the thing and I see parallels in culturally responsive and cultural humility and care to teaching, and it's another kind of care, and especially whenever he had teachers who were also dyslexic, who understood the challenge of trying to work in a system that wasn't designed for him. It's very impactful. And
I absolutely love that. I absolutely love that example, because it's not just salient because you live that. That's the life, if you will. You're in the household where this is part of your reality, and that's your personal truth, if you will, that you're having
mhm,
to live with, if you will.
mhm, mhm,
Uh, but I also, I was talking to someone and I said, cultural responsiveness, cultural humility, that level of showing up is when you get it.
yeah.
And it just and that I think encapsulates. And I love that you said those providers, those teachers, those educators who have been part of the system, and they know the toll and the obstacles and
Mhm,
barriers that these kids have to overcome. They get it.
yeah. 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 Well, um, this has been amazing. I do have a few more questions. Let's see here. So, um, What advice would you give to me and other people who are starting out in this iMBA program?
So I'll just say this. I think know that you want to do this because especially for those of us who are not just fresh out of undergrad, if you
Mhm.
will, and we have that experience at life, and we know there's going to be distractions and there's this added weight, so you're adding it, and so now you're really drawn down to minus 10% because you're
Mhm.
operating at 110%. You're there's just
Mm.
there's you really at times are having to go on an empty tank with this thing and just get through to the other line. Know your boundaries, know that you have the level of commitment because there's nothing sadder than dropping out of a program that you've committed yourself to and you got a third of the way through and you just couldn't do it. So
Yeah.
realizing that there's going to be unexpectedness in life, if you will,
Mhm.
but
Mhm.
go into it with open eyes. Two, extract every bit of value that you can out of it because once you're on
Mhm.
the outside you go, oh my gosh, I can remember Dr. whoever, Professor whoever talking about this and I think I had some notes on this, but this is really
Yeah.
really important. And
Yeah.
third, to the point that you brought up earlier, I realize it's a remote program. I realize you're
Mhm.
not in person. I realize that level of connectivity may not necessarily be there, but work hard on developing relationships and friendships. And there's number 3B also, and I'm going to share with you. To everybody out there, and this is a little bit of a come on now sort of a thing. To everybody out there who
Little tough
shows up
love.
and yeah, a little bit tough love. But if you're going to show up and think you can slide by on the backs of your colleagues who have to be twice as dedicated for group and team projects just so a project can get through the finish line and be submitted on time, maybe sit this one out because everybody
Mhm.
else out there who's by far the vast majority, 99% of folks in this program show up with clear eyes, full dedication, um, and knowing that what they want out of this program. And it's an amazing program, and it's really catapulted. And I say this, and I said this to my dean at Johns Hopkins where I got my MPH. The reason I'm at Johns Hopkins is because of my MBA at Illinois.
Wow, that's exciting. Those are big names.
Yeah.
um, well, I think we covered it. Thank you so much for your time and your, sharing your experience. You're so candid and generous and warm, and I would love to bring you back for a panel discussion if you're up for it.
Claire, I would love that. This was such a fun conversation, and I've done quite a few of these, and I'm not gonna lie, this is the most fun I've had because this was real. So super fun. Love this.
Thank you so much. Have a beautiful day. Thanks for
Thank
carving
you.
out some time for me.
Absolutely. You got it. Take care.
Take care.
Bye.
Bye.